would like to take a few minutes to explain why thermoregulation is a critical part of neonatal care. Babies born premature or growth restricted are at risk of developing hypothermia. A normal body temperature is 36.5 to 37.5 degrees centigrade. Before babies are born, they are in what we call a thermal neutral environment. This means that they do not have to expend any energy to maintain a normal core temperature. Remember, fetuses are intended to be in their mother's uterus, surrounded by a 37 degrees Celsius environment, until approximately their due date. If they are born preterm, they are suddenly removed from this thermal neutral environment. As they are delivered into the ambient air temperature, they need to be given a continuous external heat source. If not, they have to begin diverting calories intended for growth and use them instead for thermoregulation. If you think about it, the term calorie refers to a unit of heat. If babies are wasting the precious calories from milk trying to stay warm, this can stunt their growth, including their brain growth. This can affect how well they develop, both physically and cognitively. These MRI images show the brain development from 28 weeks gestation, when your preterm babies might be born, through 38 weeks gestation. When they are getting ready to leave the hospital, not only does the brain grow enormously in size, but also in complexity. This is pre-programmed brain growth, meaning that it must happen during this 10-week window. In a sense, this is your patient. You are trying to shepherd this brain safely from here to here. Nutrition and thermal care are the two modifiable risk factors that will determine how successful you are. The human body will always prioritize using calories to maintain a normal body temperature for today, before it will use them on growth for tomorrow. Some small babies use extra calories and are successful in staying warm. Some use these extra calories, but they still become hypothermic. Neonatal hypothermia is dangerous because all of the baby's body systems function poorly in hypothermic conditions. They can develop respiratory symptoms, bradycardia, coagulation disorders, and immune dysfunction. With severe hypothermia, it can even cause death. In fact, it is estimated that hypothermia contributes to 40% of the newborn deaths in low and middle-income countries. That's about 1 million deaths every year. Fortunately, we have lots of good ways to give babies the extra heat that they need to stay warm without having to use their own energy. Incubators and radiant warming tables are electric sources of external heat, but present many challenges in terms of complexity and cost. The best external heat source is skin-to-skin care or kangaroo care. Along with providing heat, it also helps in many other ways, including promoting breastfeeding and parental bonding, and reducing the risk of infection because of the shared microbiome.
When I'm helping parents to do kangaroo care, I love many things. The first of all, the baby stay warm. There is no hypothermia. The second one, there is a bonding between the baby and the mother, and the baby feel loved. During PMC, the mother can know if there is any change for the baby and can tell to the healthcare provider, so the care can be immediately given to the baby because the mother notices at the time.
ariko nyine mpageze hano baramfasha ntabwo nari nzi ko nawe yari abaho ariko ngeze hano nyine dusanga hano hari ubwoko cyane bituza nk'ababyeyi umwana wanjye aracyaye rero ndabikesha abaganga bafashe kuko icyo gihe ntabwo bigeze mbibona natekerezaga ko iyo biza kumera nk'ikibi ntabwo aba yarapfuye ariko hamwe n'Imana nyine n'abaganga baramufasha ariko.
To provide kangaroo care, the baby is placed naked, skin to skin, directly on the chest of a parent or other responsible adult. The only clothes the baby should be wearing is a hat, socks, and a diaper if available. Be sure to turn the baby's head to the side for easy breathing. Wrap a cloth around the back of the parent and baby. You may need to reposition the cloth as needed to make sure both the parent and baby are comfortable. Despite high-quality kangaroo care, some babies still develop hypothermia because the baby is still losing warmth from the back. In these instances, the Essential Newborn Care 2 algorithm recommends providing a heat-producing wrap to add heat on the baby's back. Because it is important to provide a continuous heat source while babies are small, kangaroo care should be given for as much of the day as possible. If a parent needs to take a break from kangaroo care, another heat source should be given. Ideally, this would be another responsible adult continuing with kangaroo care. An incubator or warming table also works well. If these options are not available, again, a heat-producing wrap should be provided. The Dream Warmer is an example of a heat-producing wrap. It is a skin temperature heating pad that can keep babies warm when kangaroo care is not providing enough heat or is not available. It is made of a special wax that stays at exactly skin temperature for about 6 hours. It has an orange temperature indicator that shows when it is a safe temperature to begin use. It slips inside an insulating sleeve that makes sure all the heat goes towards the baby. This also makes it easy to clean between uses. It is very safe and works well to keep babies warm, studied with well over 1,000 uses. If you touch it, you will feel that it is warm and soft like skin.
The Dream Warmer, it's a very, very good equipment. For example, sometimes we can use Dream Warmer to keep the baby warm and the mother can go to do something like do some hygiene. In that case, we are sure that the baby will no longer have hypothermia. For us, as healthcare providers, it helps us to control the temperature of the babies. So we are sure that we controlled hypothermia. It's a very, very, very appreciable idea because it's a life-saving equipment.
So, if you are caring for a baby who is hypothermic despite kangaroo care, or kangaroo care is not available, plan ahead to provide a heat-producing wrap such as the Dream Warmer. It can also be used on the labour and delivery ward for transport within or between hospitals, on the paediatric malnutrition ward, and even in the home setting. We want you to feel confident taking care of small babies, including providing continuous thermal care, the centerpiece of which is KMC. When you teach and support mothers to provide high-quality KMC, you are helping their babies to survive with the best developmental outcome. Neonatal hypothermia is preventable. Babies are our future. No baby should die from getting cold. Together, let's say goodbye to neonatal hypothermia.